for doing this.
Sure.
Great, Damien. All right, I think we have everyone here. Let me just double check to make sure. Let's see, Dr. Tumlinson, I see you. Keisa Smith, I see you. Damien Hicks, I see you. Amy Webb, I do not see you, but I am, there you are. All right, so wonderful, thanks. And hopefully everyone can hear us. I'm sure they'll be reaching out if they cannot. Appreciate everyone coming together. We wanted to just spend a few minutes. We'll try to hold this to about 30 minutes today, kind of catching everyone up around the COVID and the new surge with Omicron that's going on. We haven't done this in a while, but we have been getting a lot of questions. I know it's been impacting all of us as Arkansans. So I do want to thank Dr. Tumlinson. We all know him. He has joined us before from over at the Department of Health. He's a physician and he works with us a lot. Many of you know him on our response to COVID and with what's going on. So we asked him if he'd spend a little time today talking with us about this variant of the virus and what's going on. So let's just start directly with what is different about what we're experiencing right now.
So, Secretary Gillespie, what's different? First of all, what's just to clarify, I know there's been some questions about that because we've stopped even calling it the SARS-CoV-2 virus and we've just started referring to them by their variant name, right? It's the Omicron is still a SARS-CoV-2 virus. It's just a variant of that same virus, right? It's mutated. And so there are other mutations that happen. We never know about them. This one's got the mutations made it bad enough that it's become famous and taken the world by storm. What's different with it is really what's causing the unprecedented numbers of cases that we're seeing right now. And right, you all know this. I mean, if you've not been exposed yet in the last 3 or 4 weeks, then just get ready because I mean, you're gonna be around somebody that doesn't even know they have it yet, right? So you know, we'll talk about more about what we do in the face of that. But that just showed this variant is much more infectious than what we've dealt with before. Remember, Delta, right, was 2 to 3 times more infectious than the original version or the Alpha variant. Now we're dealing with Omicron, which is at least 3 times more infectious than Delta was. So we're getting more and more infectious. It's really infectious, okay? So that's what's different about the virus, and the difference that's causing around us is these unprecedented numbers of infections. Yesterday, we set a new record. We keep setting new records. That was almost 11,000 new cases in a 24-hour period. To give you a comparison, if you've forgotten from earlier in the pandemic, the previous high. Let me see here. I'm looking on something. It doesn't want to tell me. It was about 4,200, 4,300 back in the very early part of January into December last winter, right? That was our previous high in number of infected people in a 24-hour period. I know one of the questions, Secretary Gillespie, y'all sent me, which I'll just go ahead and address, is this question about well, it's not as bad, right? It's causing more people to get infected, but it's not as bad a virus, right? In one sense, that's true, but I want you to understand that it really hasn't made any helpful difference. Now, for you as an individual, right? When we look at the population as a whole, yes, Omicron is less often causing severe disease. That means this is made up numbers just to illustrate a point, okay? If with Delta, 100 people got infected and 2 of them went to the hospital, a variant like Omicron that has been shown to be less severe, less likely to cause severe disease, might send 1 person out of 100 to the hospital. But when the rate of infection is 4 times higher than it was with Delta, then that means more people are going to end up in the hospital, right? It's a matter of math. So that in the individual person it infects, right? Maybe that person is less likely to have a severe case. But so many people are getting infected. And we know that when so many people get infected, a certain percentage of them are going to have some comorbidity, age, diabetes, heart disease, whatever, or just because some people end up getting really sick with COVID, even when they don't have those comorbidities, more people total are going to end up being severely ill. So that's what we're seeing right now. The total number of hospitalizations right now, I think yesterday was almost up to 1,200, and it's gone up steeply over the last couple of weeks. So that's the discussion of severity that I want to leave with you. Yes, the Omicron variant has been seen on a population-wide basis to be less severe. As a percentage of the people infected, maybe fewer of them are going to the hospital, but because it's infecting so many people, more people are actually ending up in the hospital.
How long is this going to keep going? Do y'all have any sense on that, judging from what you've seen around the rest of the world and the country?
So it's a little hard to say. So, right, when we compare what we've seen around the rest of the world, we have to see, is America, or more important for us, Arkansas, how much like that other place or the citizens of that other place are we? So if you look at South Africa, they saw a peak and then it started to decline within 3 or 4 weeks, I believe. And they said, their hospitalizations were much less. Well, we're having a lot more percentage hospitalizations as they did. But if you're talking about the timing of when it might come down, England, apparently, UK, I should say, apparently think they've now passed their peak and have started having decreasing numbers of infections, and hospitalizations have even started to decline somewhat. So, they were a little bit ahead of us, as they have been in a lot of times with the different variants. But the question is that going to happen here? Hopefully, but I don't know. What I would say is it's going to be rough the rest of this month. And remember, when we get past the peak, that's just past the worst point, right? And we are not to the peak yet. If you look, this week's numbers are still going up. And so when we do get to the peak, we need to get down significantly from the peak before we can really start breathing a little easier. Yeah, it's good to get past the peak, but remember, for the days past the peak can still be at really high levels of infection and risk for people and load for hospitals. And remember that the drop in hospitals, like it hasn't gone up quite as fast as the number of cases. It also probably won't drop quite as fast as the number of cases do.
Okay, no, that makes sense. Your point at the beginning was this is a variant on COVID. What same things, right? Mask.
Yes, the good news is that all the prevention measures should work. All the non-pharmaceutical prevention measures, right, should work just as well against any variant, right? The variants aren't more infectious because they float through the air better, okay? They're just better at once they get inside you of infecting you, right? They can't make themselves fly better when they come out of someone's mouth and go into your nose. So if you still got your mask on and the other person does too, going to be just as effective against this variant. If you're, doing the spacing as best you can and keeping that distance, that's going to help. If we continue to do those other things like not going to work when we're sick, not going to school when we're sick, if we're doing all of those things that we know to do, it will help cut down on infection rates. Now, when you get more and more infectious variant, right, it still looks bad, and it is bad. The problem with protective measures is we never know how much protection our protective measures gave us. We can at best give kind of estimates, but it's hard to measure something that's not yet there, right? It's hard to measure an infection that didn't happen because you took good prevention measures. So I just urge you to continue to do that. While we're talking about preventive measures, let me just talk about vaccination, because it is discouraging when you see people who've been fully vaccinated get sick with Omicron, right? Get sick with COVID. However, what studies have shown so far is that, yes, if you're full series of vaccination is old, meaning it's been more than 5 months since you got it. The protection that it's offering you against Omicron is significantly less, right? It's well below 50%, okay? But if you get a booster, right, you know, it's been long enough for you to get a booster. That many months, your immunity has waned enough. If you get a booster, it's back up there around 75 to 80%, which is good. So get your booster. Those who aren't ready to get a booster yet, your immunity hasn't waned so much. You've still got decent protection from your original series. So do that. And as soon as you're eligible to get your booster, do it and make that recommendation to others. So that's what I'll say about that.
And then, well, we've been making progress here at DHS on vaccination rates, which is really great. And we're all continuing to work on it. So hopefully we can keep doing that, get people boosted so that if they do catch it, they won't have, they'll be asymptomatic or not much response.
And that's an important point, Secretary, that even if you know, vaccination is not a 0 or 100% gain, right? And we've all unfortunately learned that. I think we all kind of thought of it that way before. But even if, right, we all want to not be infected, right? That's why we get vaccinated, right? But even if you are infected, the statistics show you're going to have a much less severe case of COVID. That's helping maybe some of those hospitalization numbers, right? They would be a lot worse in Arkansas or anywhere if we didn't have people fully vaccinated and boosted. That is helping. They'd be through the roof already, and they're bad enough as they are. But you know, I'm glad to hear y'all are making good progress. Arkansas as a whole, you know, is behind the national average. The population as a whole, I think we're up above, oh gosh, I can't even remember now. It's 65% or something, at least started on vaccination. We continue to make progress. Like y'all have said, people are progressing, people are responding. They keep getting vaccines daily, they keep going up. And not in the Midland numbers we had kind of in the like September, October. They're all, you know, they were over 10,000 doses a day for several weeks, like 3 or 4 weeks before Christmas. And then since then, they're usually in the 7, 9, maybe over 10,000 range. So people are still getting vaccinated. That's good news.
Yeah, that is very good news. All right. Dawn, Kisa, and Damien, and Amy, do y'all have any questions for Dr. Tumlinson? Because I know he's very, very busy, but I want to make sure everybody gets a chance to ask him anything you want to ask.
Yeah, I mean, Dr. Tomlinson, I think you've answered a lot of the questions we have. I think we like to wrap things up on a kind of a quick point. If there were recommendations you could make to us and our staff while we are weathering this surge, what would those points be?
I'd say, you know, especially if we're talking about workplace issues, one, you know, keep encouraging people to get vaccinated. Those of you listening, keep doing that. Know when your date for your booster is so you can, you know, set up your appointment and go get it. 2, wear masks in the office. Now, you ought to be wearing masks anytime you're in public, frankly, unless you're in a park, right? I don't mean that. But even if it's crowded outdoors, you ought to wear a mask. But especially you're going to the store, you're going to the movies, whatever it is you're doing. If it's indoors and there's other people around, wear your mask. And that goes for work. And then at work, I recommend, I bet you've already done these things, but virtual meetings as much as possible. If you sometimes you just got to have an in-person meeting, right? Then do it with masks on, do it spaced out, make sure you got a place where people can meet. It's kind of weird. You see me, I'm in my office. I don't have my mask on, right? But that's because I'm in my office. Fine, right? And that's the way we're doing it here at the Department of Health. You're alone in your office, fine. You don't have to wear your mask. When somebody comes to the door, they've got their mask on and I put mine on. So just let's just do it again.
Okay. Right. And hopefully it won't be that much longer.
Yeah, I think, timing wise, the rest of this month is going to be rough. Hopefully middle of February, we'll see the light at the end of the tunnel, and March may be a very different story. So we're just going to have to wait and see.
All right, good. Thank you, Dr. Tumlinson. We really appreciate you joining us.
Sure.
As always, appreciate everything you do for us. Thanks. For everyone, since it's been a while since we've had to deal with a lot of quarantines, which is what we've been working through lately, Kisa, can you just, we thought it'd be useful today just to kind of remind people and talk back through, now that we're all in the middle of another surge, what goes on and what you need to be prepared to do. So Kisa, if someone in a county office or in central office learns that they are positive, what do they need to do?
Yeah, so thanks, Cindy. And everyone, we've had pretty constant communication about the fact that, you know, when COVID initially happened, we had a good routine down on what we were supposed to be doing. And now, you know, we got a little comfortable. Numbers started to wane. And now that we're in the surge, it does bear a reminder. The policy when you are positive is very simple though, guys, very simple. If you are positive, stay at home. Like there is no exception to that. I cannot tell you how many times I, get a call, get an email, get a Skype because someone felt good at 9 o'clock in the morning or 8 o'clock in the morning, even though they knew they were positive, and they drove to work and they got to work and they started going downhill. And at that point, you have risked a lot of your coworkers by pushing through. We really do. I can't say, we appreciate your dedication to your job and what you're doing. We know you care about the work that we're doing, but if you know that you are positive, stay home and then contact your supervisor so that we can begin the process of contact tracing and get that done. So your supervisor is going to know who to reach out to so that they can start that process, but you alerting them is going to be key, and alerting them quickly is going to be key so that we can then equally alert anyone that you've been around. So we just want you to remember that. Keep your phone on after you talk to your supervisor so we can do the contact tracing. But again, stay home, notify your supervisor, keep your phone on so we can do the contact tracing.
I think that it is advice we all need to follow clearly, and policy. But one of the things I think we get a lot of questions about is, so who goes home? How do you decide who goes home?
Yeah.
Someone who you've been exposed, what's the decision? How is it made about who's going to go home, which floors are going to clear out, how they're going to clear out?
So, one of the things, and I think Dr. Tumlinson touched on this, we are learning a lot about COVID. I think all of us have spent a lot of time reading and learning, and we've learned a lot about who is really at risk when someone is COVID positive. And it is still, guys, that close contact. It's the individuals that have been within 6 feet of the individual, or the people that have been in meetings with that person unmasked, face to face, because this is a respiratory disease. So sometimes what you all will see is that now versus back when COVID began, when we find out someone is positive, we're doing that contact tracing quickly, and we are sending the individuals home who are going to be in close contact. Now, the only time you will see a difference is if someone has been positive within a short period of time. We may send more people home because we're doing cleaning, but that is the exception. It is still that we're sending individuals home that have close contact. And trust me, guys, we are making sure that we're doing that contact tracing quickly and notifying you all quickly. And so the people that we are contacting are the individuals who have been in close contact with someone positive.
Okay, wonderful. And I should just remind everybody, in case there are folks on this call who work at our facilities, what we're talking about right now is are the ways that we take action and what goes on if you work at central office or if you work in the county offices. The facilities have their own policies because of the work they do, and obviously you would adhere to the facility policies. So you have been positive or quarantined, how do you know when to come back to work?
So I'm going to flip that question to Damien. So,
Okay.
All righty. Yes, we're right now in the process of updating our return to work that will be sent out later today. Like Cindy said, this is only applicable to those in central and the county offices, and facilities have their own, current guidelines. But the only change we're making is regard to, vaccinated individuals. And if an employee has been exposed and vaccinated and boosted or not eligible for a booster, quarantine will not be required unless they're positive or symptomatic. But if you are vaccinated and eligible for a booster but not, you will be required to quarantine. So, we've also on our flow chart that will be sent out later today, but we're also, adding in there about making sure your supervisor, making sure HR is always in the loop, because they will also initiate any contact tracing that needs to be done. And, we've also listed the CDC cleaning procedures also on the flow chart that people can go and view, along with a link of who can get boosted and who are not eligible. So we're keeping it hopefully as simple as possible, but that will be sent out later today. And like always, if you have questions, please go to your HR liaison and they can help you work through those issues.
Okay, so if you're not sure when you should go back to work, you
Yes,
call your
please.
HR liaison.
Yes, please get in touch with your HR liaison and they can figure that out for you.
Okay, not your supervisor, but your HR liaison.
Yes.
Okay. All right. A lot of our employees are parents. And with this type of rise in cases, a lot of schools are closing for a week, a few days, a week, long term, even longer than that in some cases, potentially, because they're short on staffing. Can you kind of walk people through what we have available to help in that case? Because a lot of folks are finding themselves with children at home when they didn't expect it.
Sure. So DHS has been approved for remote work for those staff whose job allows, where their childcare facility or their school is closed due to COVID. We have already developed, it's been in use, a childcare form that is required for the employee to fill out. They'll put the child's name, the school they go to, the dates of when they will need to remote home. And that has to be signed off by your HR liaison and then also approved by your division director or office chief. And those forms can be obtained through your HR liaison, as always. And then also all this information in regard to the return to work, all the forms will also be on the new SharePoint site for people to have access to always get the information readily available for them.
Okay, no, that's very, very helpful. Y'all mentioned cleaning a few minutes ago. We're getting a lot of questions about that. I don't know which one of you would want to take this question, but could you please explain when and how we clean?
yeah, I'll take that. And anyone else, feel free to jump in. But I know I sound kind of like a broken record, guys, in that I keep talking about the differences between today and when COVID began. But when COVID first became a reality for us, you all will remember that we had individuals coming in and they had kind of the full hazmat suits on and they were, doing the spray, and we had you all, leaving, we were vacating full floors and full buildings because of the chemicals those individuals were using. And I know a lot of you all have concerns now because you're not seeing those folks with the full suits on. And that's raising concerns because you think we're not taking this as seriously as we are. So we wanted you all to know that in the course of learning more about COVID, what we are equally learning is that The spread comes with individuals interacting with each other in close proximity. So it's having those meetings, having those gatherings. I know you all miss having potlucks, but that's what's leading to the spread. It's not that because I have COVID and I touch my door handle and you come through 20 minutes later and touch it as well, you're going to get COVID because of that. That's not what is attributing to the spread, and we've been verifying that, and we are consistently looking at CDC standards. And so what we have is we have enhanced cleaning that is tied to when an individual has been in the facility, in the office space for 24 hours or less. And that enhanced cleaning differs based on whether you're located in central office or in county office in terms of what it looks like, but it's still being done to the level that will make sure that you all are protected. So we wanted you to know that that is still happening. It doesn't look like it did in the past, but it is still occurring, and we're still making sure that we're disinfecting areas when it's called for.
Okay. Amy, I think you had a question. She's bringing me a question she wanted to ask. Okay. We all know it is taking a long time to get tests. I mean, I think every one of us knows people who have waited in line for hours and hours or gone to multiple sites to get tests. So you all had a conversation this morning about making some adjustments.
Right.
Yes, we accept. Do you want to talk about that, please?
So this is literally, Cindy, to your point, this is hot off the presses, meaning we just had this conversation this morning. We recognize that we're telling you, if you're positive, to stay home, and you're saying, how do I know if I'm positive if it takes 7 hours to get a PCR test, and my doctor's saying it's going to take 3 days before I come in. As many of you know, the governor has been discussing a lot about free at-home tests. They're making them available across the state. We are going to roll out a policy immediately that will allow you to take an at-home test. And if it shows that you are positive, we will accept that positive result from the at-home test as proof that you are positive for COVID and need to stay home. You're going to have to show the result, and we're going to have you sign an affirmation that those results are in fact your results, because guys, we need you to be truthful with us. But once you show that verification, then we can switch you to director's authorized leave, and we will take that as a positive verification of you having COVID.
Okay, wonderful. And as long as we're talking about testing and director's authorized leave, we have been getting the question about whether people can use director's authorized leave to go wait in line for the testing, to spend the day doing that. Damien, would you like to address that?
Sure. So we are not approved to utilize director's authorized leave for you to go wait in a line to get tested. Director's authorized leave is only approved, and we're allowing, 1 hour for you to go get your COVID vaccine, your booster. And then it's, also allowed for those employees who are COVID positive or required to quarantine and that are unable to work from home or remote work. Everyone needs to be aware, though, that director's authorized leave is limited to 80 hours. Once those 80 hours are up, you are on your own sick leave, or if you don't have any annual leave, and if you don't have any, leave without pay. So, we're trying to make the best of this situation, and we'll follow, all the guidelines once your results are received, and, kind of go along with our chart and everything. But currently, director's authorized leave is not for going to stay in line and get tested.
Okay. All right. So that if that changes, we will let you know. But right now, that's the approvals that we have. Okay.
Hey, Cindy,
Yes,
can I
Amy.
add something?
Yes.
I just wanted everyone to know that the state has purchased the rapid test, and they're at local libraries and local health clinics. The libraries are running out, at least they were in Pulaski County, but they put out a notice this morning that they have been refilled. So if you need a rapid test, they are hard to find at Walgreens and that sort of thing, but you'll be able to find them at your libraries and your health centers. And some churches have them too.
Great. No, that's wonderful. And also, Amy, could you put out again today, just a reminder to everyone of how to reach our COVID response team if they need to, because people may have questions that they need to talk to Jen or Jeff about. You know, they have been so wonderful to work with everyone as we've gone through the months. And I know Jen has, many of us have consulted Jen, who is an APRN, with issues as we have gone through this. So just, if we'll put that out just to remind everybody how to reach them. You get the emails from them every Thursday, but it's also, please do feel free to reach out when you need to reach out. Before we break, do any of you have any other thoughts you want to share before? Because we are coming up on 1:30. Okay. What I do want to close with this, and I think Kisa, you were the one who mentioned this as you were talking. You know, we find ourselves, we had gotten comfortable. We now all find ourselves back with another surge going on. And hopefully Dr. Tumlinson is, you know, as he said, hopefully we'll have another short period that this surge continues, and then hopefully quickly it will begin to recede. All of us doing what we can in this period to stay safe, keep others safe is incredibly important. It's, but I also want to close by saying this isn't where any of us wanted to be at this point in time. I know that. I didn't want to, none of us wanted to be here. I have to say thank you. It's so inadequate, but thank you for all that you're all doing. Work changes every day with the quarantines. It changes every day with who's in and who's out. And it's scary when people are positive, and it's scary when you quarantine because you've been exposed. And whether you're able to work or not able to work when you're at home, y'all are continuing to keep people in this state safe and to keep benefits and programs going. And it is absolutely amazing. I just, you know, we all hate that we're back in the middle of another surge, but all I want to do is say thank you for all you're all doing, because the work you do is always some of the most important and critical work in the state. And as Kisa said, so many of you, you know, do everything you can to keep being able to do that work because you care so much about people. And I think we're all just grateful to be working with people like you. So thank you for coming to this, and hopefully this tells you what we know. And as we learn more, we will continue to share and get through the next few weeks together. Thank you so much. Bye-bye.
Thanks.